I'll just give you a little bit of a quick rundown about the things that we're doing in this project, and Bart will fill you in on some of the detail. Now, the project itself, we are aiming to identify national competency standards for oral health functions, and certainly reflecting on Martin's presentation, there is a significant role for people that do work in children's services, that do work in Aboriginal health, that do work in aged care, and the Skills Council includes the qualifications that are the foundation for those workers and the competencies. So again, via this project we have the opportunity to establish some national competency standards for some really targeted oral health areas. So that's what we're looking at producing, the actual competencies in the packages, and also at the end of the project we'll want to produce some implementation strategies that will support the actual implementation of the competencies, getting them going. So we'd love to be able to stay in touch with some of you about producing some case studies towards the end of the project as well. In terms of what we've done with the project so far, we kicked the project off in about June this year, and these are the key project activities. We've established our industry reference group, which is largely draws upon all of the relevant bodies within the oral health sector, plus some organisations from the broader health and community services industry, such as Aged and Community Services Australia, representing the not-for-profit aged care sector, the Australian Nursing Federation, and we'd also invited a position for the National Rural Health Alliance. So that industry reference group has been formed, and it's met on, I think it's 3 occasions now. And the first part of the project is a scoping and consultation phase, and Bart O'Brien has been our Chief Research Consultant working on production of the scoping document, and we do have a summary of that document or that work to date, and it's included in your package, and I'll just draw that to your attention now, and I encourage you to have a flick through, and particularly to the tables that we have towards the back of the document. And so Bart will be filling us in on some details of how we got there, and then later this afternoon in the final session, Bart and Margaret Clark, our Chief Technical Writing Competency Consultant, will undertake a workshop with the group today to test some of those results. Now, one of the other milestones in the project was we wanted to hold a forum, which is today, so we're here and holding that forum today. And the forum is a key part of certainly promoting the project, and again we'd like you to spread the word about the project for the next stages, which will be development of and drafting of the competencies. Much of our work to date has been with the oral health professional groups. We need to work closely with them and to ensure that their expertise is brought to bear prior to and in conjunction with working with the rest of the community services and health industry, who are really the key targets of this work. So again, in terms of the project timelines, this is just the final slide in this section. We are still at the start of the scoping phase, and we are aiming to finish the scoping phase with a scoping report in February, and this forum today is a really important part of that phase, and the information from today will be fed to the industry reference group for their consideration in production of that final scoping report. So again, we want to aim to have that report finished and released in about February, and at the same time to produce a set of draft competencies to commence consultation. So we're very much at the start of the process, and we note here that we'll be looking at holding a validation session in each state and territory for our first draft stage, and looking to wrap the project up towards the end of next year. So I'll leave it at that in terms of what we're doing, and pass over to Bart to fill us in terms of what we've come up with at the scoping phase.